My name is Audrey Barnhart, and I did my research paper on conversion therapy. Just to give you a little bit of history, throughout the 1900s, conversion therapy was extremely unethical and damaging, and their attempts to reverse homosexuality was a fail. They used different types of techniques: cognitive, behavior, psychoanalytic, medical, religious, even corrective rape. These showed no signs of fixing homosexuality. Finally, in the 1972, the American Psychiatric Association removed homosexuality as a mental illness. They said there was no evidence to say it was a mental illness and removed it from the DSM-5. I picked this project because there's no evidence that conversion therapy works. The evidence is even going against it, and it's still legal in 29 states. I also picked it because I'm a social worker and I need to advocate for those that are vulnerable. And in the Code of Ethics, one of the principles is dignity and worth of a person, which is really important to me. My hypothesis is that conversion therapy is unethical, and there are more beneficial forms of therapy for the LGB community, LGB being lesbian, gay, and bisexual. The participants in this study will be members of whose sexual orientation is LGB, and anyone that has not been through conversion therapy before. There are 18 participants for this study that is donating their time, and those participants have been given a consent form, which is in the appendix. The purpose of this study is to see how different the LGB client's life satisfaction fluctuates after receiving either conversion therapy or acceptance therapy. We'll be measuring the data by using an independent t-test. The way we're going to do this is we're going to compare two different therapies using 10 closed-ended questions with a 1 to 3 scale, and with one section allowing notes from the therapist if they feel they need to communicate anything to us, which is in Appendix 2. They will be going to therapy for twice a week for 6 months, and the therapy sessions will be 50 minutes long, and the therapist is asked to give the questionnaire 10 minutes before the end of the session. Highest score they can receive a week is 60, and the lowest score they can receive a week is 30. I expect the study to take about a year. I used the sample one given from the university, and like I said, I used an independent sample t-test to compare the two means. The null hypothesis is that there would be no difference between conversion therapy and acceptance therapy. For the participants in conversion therapy, the mean was 34.66. The standard deviation is 5.24, and the degree of freedom is 16 for both studies. For the participants that were in acceptance therapy, the mean is 44.44. The standard deviation was 3.20, and the level of significance, or alpha, was 0.05, and our p-value was 0.00. This means the participants who were associated with acceptance therapy had statistically significantly life satisfaction than the participants that were in conversion therapy. We now have strong evidence to reject the null. The equal variance assume that the t-value is negative 4.772 and the f-value is 2.156. The findings in this study support our hypothesis that there are more beneficial therapies out there for the LGBT community than conversion therapy. Our findings were expected because there have been many studies about this. Many studies of how conversion therapy, there's no evidence supporting it and that it's actually pretty damaging. And we now know that there are many different types of treatments that the LGBT clients would benefit from. Some of these including acceptance therapy and emotional awareness, teaching them how to reduce avoidance, and validating sexual minorities by showing their unique personal strength. Implications of the findings and past findings show that conversion therapy should be illegal in all 50 states. But if the state does not take responsibility, it's the social work's duty to challenge social injustice. Some limitations in this project are that participants have to go to conversion therapy, and that we need clinicians that are willing to use techniques for conversion therapy, and it makes a lot of people uncomfortable because it's ineffective. Another limitation is that something tragic could happen to the participant throughout the project and the study. If that happens, like I mentioned, there is a note on the bottom for the therapist. The therapist will notify us that, and we will take out their score. The research needs to be conducted in a state that allows conversion therapy, or you can go and get into some legal issues. So using peer-reviewed literature and creating this study, we have found that our hypothesis is correct. Many steps need to be taken to remove conversion therapy from each state and agency. As of now, I recommend that we follow the guidelines given by the NASW and the APA. Thanks.